Hello, my name is Dr. Dasha Birek. I work at Lieb Dein Gesicht. Today I would like to talk with you about hyaluronidase. Hyaluronidase can dissolve hyaluronic acid. It's an enzyme that cuts hyaluronic acid into little pieces. Today I will show you how I dissolve a lip, and we'll talk a little bit about what you have to know about that procedure. Here I have some hyaluronic acid. I'll put it on a mirror and then I will add some little drops of hyaluronidase and we'll see what happens. You can see that the product loses its form and loses its viscosity. It is dissolved quite quickly, and when we add some massage, it disappears within minutes. I will tell you why I decided to dissolve this lip before doing a new injection. We have different markers that show that the lip has been overfilled. The first marker is the white line up here. You can see like a white sausage going around the lips, or maybe you can call it a hollow. And this indicates that the filler has migrated upwards. Also, please smile a little bit. There's this fine line appearing, which I call the ducky line. It also indicates that the product has settled up here and is quite typical for overfilled lips. Then we have some bumps that you can see here. Yeah. Our goal is to dissolve all the bumps and the migrated filler here. The problem with the filler that moves upwards is the following one. It pushes the lip down and it turns the lip inside. So if a patient wants the lip lift to lift the sides up, it cannot be performed as long as there is material pushing the lip down. It's quite a vicious circle. Many patients come to their doctors and wish for more red part of the lip and the red part of the lip to be lifted upwards. And they inject more and more hyaluronic acid, and all that happens is that the lips move forward and inward. If we look at the patient's face from the side, there's quite a ducky appearance to that lip. You can see that the lip is a little bit too far to the front for the patient's ideal profile. My experience shows that it's very important to dissolve this part of hyaluronic acid that has moved upwards. There are new studies that indicate that this hyaluronic acid will not dissolve itself. It stays in this white part of the lip for maybe 15 or 30 years. So the only way to get rid of it and to do a new nice shape of the lips is to dissolve it with hyaluronidase. So maybe you have seen those friends in the videos before. I'm not a crazy collector of fancy dolls. They're actually anti-stress dolls, and I like to hand them out to my patients so they have something to press on during the treatment. Here you go.
Thank you.
In my opinion, it makes sense to use a hyaluronidase that has been dissolved with a lot of liquid, so it can reach all layers of hyaluronic acid and do a more effective dilution. I always do a proper disinfection of the lips. It doesn't taste very good, but it's very important. And now we can start treating our patient. Take a deep breath, open your mouth a little bit, and let's go. In between the injections, I always take time for the massage. That's the part that most patients don't really like, but it's very important to improve the dilution effect. So when we apply hyaluronidase on your lips, it might take 2 or 3 days to work. In this time, it is absolutely normal if your lips feel a little bit empty, because even some of your own hyaluronic acid could be dissolved. 2 or 3 days after the procedure, your lips will look like never treated before. After the application of hyaluronidase, you need to wait at least 48 hours before you can add new filler to the area. Nevertheless, I recommend to wait at least a week or 2, because the injection of hyaluronidase can also cause reactive swelling. My experience shows that it's always better to inject a lip that has no swelling left. I really hope you enjoyed this video. If you liked it, give us a thumbs up. Don't forget to click on the subscribe button so you don't miss out on the next video. Always feel free to leave a comment below, and I hope to see you guys soon.